Hey, my name is Lisa Coriel. I'm the executive director of the Philadelphia School of Psychoanalysis. And today I'm joined by one of our esteemed faculty members, Dr. Priscilla Bright, to talk about the webinar she will be offering this fall. Dr. Bright received her doctorate in clinical psychology in 1983 and her certification in psychoanalysis from PSP in 1984. She's a senior supervising and training analyst at our institute, and she serves on our board of directors. She's been a psychologist and psychoanalyst in private practice for 35 years. She's also an executive development consultant where she uses the principles of psychoanalysis in her work. And Dr. Bright has a long history with PSP. She previously taught maturation and development for 10 years, and she returns this fall to teach a new course, which we're here to talk about, Supervision of the Supervisor. Welcome, Dr. Bright.
Thank you. I'm so excited to be here.
I'm so excited to be talking with you today. Can you tell us a little bit about the course and who you think might benefit from it?
Well, the supervision of the supervisor is a very unique course. There aren't many articles or approaches that focus on how a supervisor learns to be a supervisor. And I think that we're really looking for people with master's degrees in psychoanalysis, psychology, social work, professional counselors, and we're open to others who want to contact us and talk to us about their backgrounds.
Mhm. And then very specifically, people who have an interest in becoming a supervisor, right? And if they're not already a supervisor.
Right.
So
Exactly.
perhaps if they're already a supervisor, fine-tuning their skills and maybe getting a different perspective on the supervisory relationship, would you say?
Yes, definitely.
Mhm. So I know that you've done a lot of research in preparing for this course. What have you uncovered in that research, and are there any particular authors who stand out?
Well, I would say that at the very beginning, it's amazing. In the 1950s and 60s, supervision was largely pedantic. It was somebody in the field telling another person in the field what to do and how to do it. There really wasn't any mention of what the patient was feeling and how the supervisor was feeling. After that, in the 70s or thereabouts, Donald Winnicott began to examine his own feelings when he was with a patient. Prior to that, if somebody had feelings from a patient, especially in an analytic institute, they were sent back to their psychoanalysis to work on those feelings. So if you started to feel subtly depressed when with a really depressed person, then it was considered your pathology. So in the 70s, Winnicott really opened the door by saying to people, no, look, my feelings are a valuable attribute, and we need to examine my feelings as well as the patient's feelings. His feelings are a parallel process to mine. And, over the next 30 years, people also looked at ways in which the supervisor's feelings could be induced in the supervisee, and then again in the patient. And there became a kind of flexible openness to examining all these feelings, which I think then trickled down to the patient. A much more trusting and open relationship.
And collaborative, it sounds to me.
Right. Absolutely.
Much more of a collaboration than the supervisor just telling the supervisee what they're doing wrong.
Right. Exactly. And most recently, there have been a great many articles looking at diversity in supervision. There's been some difficult stories about people who were supervised by someone who didn't understand their cultural background and couldn't conceive of why they were working the way they were.
Mm-hmm.
There have also been a lot of articles examining what the role of the supervisor actually is. For example, should the supervisor contain the feelings from the patient and then slowly feed those back to the supervisee in a way that the supervisee can digest and then help the patient with?
Oh, that's really interesting. It sort of slows the whole process down so it can be
Right.
examined and understood. That's really interesting.
And there are a couple of other authors besides Donald Winnicott, and that is Nancy McWilliams wrote a wonderful book on supervision, and it's been used in a lot of the excellent programs in psychology and elsewhere, and has been used at PSP as well. There are also several articles from people in modern psychoanalysis, including Hyman Spotnitz, who wrote an article on the trends in modern psychoanalytic supervision. And then we have two people who are very good, who come from the relational point of view and are also focused on the feelings, including Joan Sarnat
Mhm.
and Jessica Benjamin.
And are these all authors that you'll be covering in the course?
Yes, we will. Yes, and these are all ideas we'll be covering in the course, and we'll be examining them from probably the points of view of 25 different authors. So when you come out, you're going to have a very rich sense of what supervision could be and begin to develop your own unique style.
Oh, that's wonderful. Can you tell us a little bit more about how long you've been supervising and what disciplines you supervise?
Well, I've really been supervising for 35 years, and I've been supervising interns as well as postdocs and people that are certified analysts. So I might start out with an intern, and then when they get, their license, they might come back to me for supervision and want to work on becoming a training analyst or a supervising psychologist at a clinic. And I also work with professional counselors before and after they get their degrees.
Mhm.
And then again, if they want to be certified as an analyst or go out into the world and do supervision. And I think it helps a lot to deal with people at different levels of training, because then you find out how somebody puts together their ideas of what a supervisor must be to be successful.
Mhm. Can you tell us more about how you have applied psychoanalytic principles to your work as a consultant?
Yes, well, when I started out in corporations, I was working with people that had no awareness of their thoughts and feelings. And not one person over 20 years of doing this had ever been in therapy. So it was a process of using modern analysis, including a lot of joining, reframing, and so on, to help them to examine what was going on around them. And for example, I had this one woman who constantly criticized her boss and refused to speak to him. And he was the head of the corporation. He wanted to fire her just for not talking to him. And she said, he's tortured when women talk to him. And I have to ride in the elevator with him. I said, so don't you want to torture him? And she said, well, yes. And I said, well, why don't you talk to him then? And she thought that was a wonderful idea. And she talked to him, and he came to me and said, wow, that was so fast. She's changing already. Um, But there were many other times when somebody who talked about sitting in meetings and getting certain feelings from people or being talked to in a certain way, not very nice way, by certain people. And, lots of these people that were having trouble were women in the corporate world with men. So I would teach them how to respond to those questions in a way that would take the sting out of it. How to, even tilt their heads and smile and say, oh, you may be right. But at the same time, come around with an enormously unique idea, which then would be bought up by everyone in the room. But by taking that sting out of it, it allowed other people in the room to be open to what the person was saying.
Mhm. It's so interesting. What you're describing is what it calls to mind for me is the work of psychoanalysts is really about learning how to tolerate the feelings that are generated in you when you're working with a patient. But
Right,
that can be expanded and applied in so many other ways, just as you're describing.
right,
In work settings, you need to tolerate your feelings and the feelings of your coworkers or boss
right.
in order to function well. As a parent, you need to tolerate a lot of feelings when you're raising your children. It's all about learning how to tolerate that, and that's what you're describing in this supervisory relationship. It sounds like.
Right. And in a lot of these corporations, the women had worked on themselves to be assertive. And the assertiveness was experienced by the men as, oh, here's my mother yelling at me again.
Uh-huh.
So I started to work with them on a different way of being. I would ask them, do you want to have more control in this situation? And they would say, oh, yes. I said, well, how about if you don't say very much, but we plan a way to go around them and come in from the back like mountain lions do. They don't stalk their prey head on. They're smart. They go around the back and come in from that point of view. So they had to learn to relax and listen to what the person was saying and not respond. That was an enormous growth thing for them. And I had to really work with them to agree to it because they thought if they didn't fight back instantly that there was something wrong with them.
Mhm,
It was a weak female position.
mhm,
But we worked on their working around the person and, finding other people to join in with them in meetings so that the person was taken unawares or lots of other things like that, but always taking the person unawares from behind.
mhm,
And it was, it became much more fun.
mhm. Well, getting back to the supervisory relationship in modern psychoanalytic supervision, have there been any particular themes that you've noticed with your supervisees or in the supervisory relationship?
Like the themes at the beginning, as I said, are really pedantic, but what needs to be done is for the person you're working with to feel that you are someone that can be trusted so they can try out new ideas on you. They can figure out what works and what doesn't work. And if something doesn't work, I tend to not care. We'll look at it and see if it doesn't work and what might have been the reason that it didn't work. Because that's really where the learning comes in.
Right.
And then the other thing is that the supervisee really has to try and understand all the different roles that a supervisor enhances. So, or that a supervisor reflects. So, for example, the supervisor could be a person who is someone who is actually asking the supervisee for help with a patient. How do you think we should approach this patient? It builds the person's self-esteem to think that the supervisor doesn't know everything.
Mhm.
And the last thing I think is, and really this is so important, I've had supervisors who could not tolerate it when I finally was beginning to develop my own unique style and was branching out from their style. I had to change supervisors because, you know, my patients were responding well, but my supervisor wasn't responding well. And there are supervisors who are joyful when you begin to show your own individual style. And it's very important that you develop your own style because you're not going to have the supervisor with you forever.
Mhm. That's a very important message to give to supervisees. I imagine that gives them the idea that they're free to explore their own ideas about how to conduct the treatments that
Right.
they're engaged in, and probably liberates them to be more candid with the supervisor,
Absolutely.
which is so important. One final question: what prepares a clinician to be a good supervisor, in your opinion?
Well, I think that a good supervisor is somebody who has been through a therapy or analysis of their own and knows how to contain their emotions, how to reflect on their emotions without acting on them, including speaking out before, you know, the situation warrants it. I think it's important for them to have an open personality, to be welcoming to new ideas so that they don't shut out whatever the patient is expressing or whatever the supervisee is expressing.
Mhm.
They really need to be brave and go into areas where they've not treaded before because they're going to encounter those.
Well, Dr. Bright, thank you so much for taking time to speak with me today and share your thoughts about supervision and the supervisory relationship. I'm very excited about your new course, and I know many clinicians will really benefit from your expertise. And for those listening, I invite you to visit the PSP website and learn more about our fall live webinars and our psychoanalytic training program. I will leave the links in the notes. Most PSP courses are open to the public. In other words, you do not have to be a matriculated student to register. And we offer continuing education credits for social workers and professional counselors through our MBCC accreditation. Thanks so much for listening and have a good day.